This is Dr. Epstein. I'm doing a case on a patient that we're doing around 1,600 grafts packed into his frontal temporal hairline. I'm going to go ahead and cover him up. But let me show you what we're doing right now. Karen right here is planting the grafts over here on the right side. We're using very tiny recipient sites, 0.5 millimeters up to 0.8 millimeters for the 3 hair grafts. So the single hair grafts are going in these 0.5 millimeter recipient sites. When I go to meetings, I'm often asked by doctors, how do we get so many grafts in such tiny recipient sites? And the answer is it's just a matter of experience. So we're able to place these grafts into these 0.5 millimeter, 0.5 millimeter recipient sites to give a nice refined look along the hairline. So basically what I'm doing right now is I'm making the recipient sites, and the way I like to create these recipient sites is I make these little triangles, 1, 2, triangle, 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 and first we go ahead and we fill these triangles with single hair grafts, then we put 2 hair grafts here, and then 3 hair grafts higher up, just like Karen's doing on this side. After we do this first pass, I then come back and make more recipient sites. I not only fill in within the triangles, like for example I see a little space there, and I'll go to make a little triangle, a little space there, a little space there, a little space there. So after we do this first pass with the 1 hair grafts in the front, front 3 rows, 2 hair grafts here, and then 3 hair grafts here in 0.7 and 0.8 millimeter recipient sites, we then come back and do another pass to fill in further. Now the other thing is we're using ACell on this case. ACell is regenerative technology. We've been using it now mostly on an experimental basis as we're learning more and more about it. But basically Karen's using it on her side. The grafts go into, are soaking in what's the ACell fluid. Come on over here, Cindy. You can see it's sort of a powdery fluid. It's got a little bit of a film to it. That's actually the ACell powder. We let the grafts soak in this ACell. These grafts are soaking in the ACell for usually around 20 to 30 minutes prior to being planted. The concept behind ACell is it improves the percentage of hair growth, and it may also be used for what's called auto-cloning, which is where we pluck beard hairs, stick them in there, and then pluck them right into the, stick them in the ACell and then place them right into the scalp. The concept is they may grow, and meanwhile the hairs will continue to grow in the beard. Anyway, this is Dr. Epstein showing a rather densely packed 1,600 graft follicular unit grafting procedure with the use of ACell. Thank you very much.